I'm Bruce Marshall. This is the Brampton Now update for the week ending the February 6th, 7th weekend, 2021. Coming up, the Good Doctor Loh has good news and his support, along with some strict recommendations for school reopening. His begging for help from the Ministry of Labor at the federal and the provincial level coming up as well. Details on that and more coming up in this Brampton Now update. Here's what's happening this week in Brampton. With the good news and a measure of caution, Peel Chief Medic Dr. Lawrence Loh.
Trends across Peel and in Brampton, after a long plateau, are starting to finally go in the right direction. Starting, but we aren't there yet. Unlike the first wave, we have two additional factors in the mix: variants and vaccines. Aggressive variants first detected overseas, notably B.1.351 and B.1.1.7, have been detected and are spreading in Peel, representing a threat to the progress that we have made in the past months. And while concerning, these variants are not a new disease. They are still COVID-19, and the actions that we already take every day to distance, mask, and stay home as much as possible will help to slow and stop their spread. That means the power to stop the variants is ultimately in our hands.
School reopenings on the minds of many. Dr. Loh supports school reopenings. While those decisions will be made at the provincial level, he has some recommendations.
That support, however, comes with significant recommendations for when schools do eventually reopen. Firstly, reopening of schools should occur before any other community restrictions are lifted. Secondly, rapid testing should be deployed where appropriate for early detection of cases and outbreak. Thirdly, we must build on existing infection prevention and control measures already in place, including screening, masking, and dismissals. And finally, self-isolation remains essential when someone is not well, especially if someone else might be sick at home. Ultimately, the safety and well-being of our children and community must place schools reopening as the next priority in our journey.
And as schools reopen, we all have to keep doing our part. Dr. Loh.
So for those who are able, I thank you and urge you to continue staying at home as much as possible, working and meeting virtually. Limit all in-person interactions with anyone outside your home to an absolute minimum, and when you do, always ensure that it is for an essential reason and that you wear a mask, distance, and limit the duration of your interactions.
Late Friday, the provincial government announced that schools in Peel region will reopen on February 16th. In a moment, 25% of people with COVID cases went back to work with it for at least one day. They take a day off, there's no pay. This is a public health problem now. Mayor Brown with more on that next on the Brampton Now update.
The COVID-19 pandemic in Canada is serious. We must continue to practice all public health measures. Follow local guidelines for gatherings, maintain physical distancing, wash your hands, wear a mask, and download the COVID Alert app. If you have symptoms, even mild ones, stay home. Protect yourself and others. We've come too far to stop now.
A message from the Government of Canada.
This is the Brampton Now update. I'm Bruce Marshall. A number of pieces still missing from the federal and provincial responses. Not near enough inspections by labor ministries at both levels of government. For example, according to Dr. Loh and Mayor Brown, the other missing piece, paid sick days across the board.
This is a tool we need. The country's not going to be vaccinated for probably another half a year, and so we've got significant distance before we're going to have a herd immunity, and we really need to have these tools available. And based on the data that Peel Public Health has shared, this is a glaring omission in terms of the tools that are required to protect the public. In Peel region alone, if you look at the contact tracing and the cases that have been studied since August, 25% of the cases have gone into work sick, have gone into work with COVID-19, and that's unacceptable. You wonder how you get COVID-19 outbreaks. You wonder how you get household and community spread. It's by having gaps in our response like that. We need to make sure that if someone is sick, they don't have to choose between staying home or putting food on the table for their family.
Dr. Loh recounts for the umpteenth week the help needed from labor ministries at the federal and provincial level.
For our essential workers, we also continue to need more inspections, investigations, and protections. Measures such as paid sick leave, proactive workplace inspections by our Ministry of Labour colleagues, rapid testing in the workplace, all of these remain critical to protecting those who cannot work from home.
But the doctor's demands have been falling on deaf ears at both the province and the federal level.
Also vitally important that measures be taken to protect our essential workers, for whom staying home is not an option. And that means three things: inspections, investigations, and protections. Our Ministry of Labour colleagues must be further empowered and resourced to blitz highest risk sectors and fine non-compliance. Those for whom working at home is not an option, and those for whom self-isolating without pay represents a risk. For those workers, we also still need inspections, investigations, and protections. More support for our Ministry of Labour colleagues to blitz high-risk sectors, not just big box stores, and enforce and fine non-compliance.
But the doctor's demands have been falling on deaf ears at both the provincial and the federal level. They need to do better. People are dying because the Ministry of Labour isn't doing their job. Dr. Loh again.
Inspections, investigations, and protections.
I just don't know how Dr. Loh could be more clear. In a moment, Brampton is becoming a city of arts and letters. 3 bestsellers on the book charts. Up next on the Brampton Now Update.
This is your invitation to hear our stories, to engage in our traditions, and connect with our history. Connections as varied as the land. Come experience our country's heritage. Find and book your authentic Indigenous experience at indigenouscanada.travel.
I'm Bruce Marshall. This is the Brampton Now Update. Brampton is known for many things. The Flower City is one. We found out through the pandemic that a lot of Brampton people work in the warehouse and transportation sector, so we could be the working city. But we're also a city of letters. 3 Brampton authors occupy the national bestseller list last week. Cree Métis author Jesse Thistle tells his story of addiction and redemption. Today, a history professor and a leading voice in a number of areas. Rupi Kaur's book, Homebody, is described as a collection of raw, honest conversations with oneself. Kaur, of course, rose from hosting YouTube from Brampton to hosting network TV in Los Angeles. The latest addition to the list is the latest from Brampton's J.L. Richardson. Her novel, Gutter Child, has just entered the bestseller list. Richardson, in addition to being an author, is founder of the Fold Festival of Literary Diversity based in Brampton. The fest is designed to give a voice to those who may be ignored by other book festivals. J.L. Richardson also sub-hosts on CBC Radio's Q. Brampton stories are being told. And that is our story for this week, the Brampton Now Update. Please subscribe to the Brampton Now Update channel on YouTube or follow #MarshallMinute on Facebook for lots of Brampton need to know that you won't find anywhere else. Your comments and suggestions are always welcome, and if you've got a Brampton story to tell, get in touch with me through the channel you're watching on right now. Stay strong, Brampton. Brampton strong. We're all in this together. I'm Bruce Marshall. Thanks for watching Brampton Now Update.
Quiet, numbskulls, I'm broadcasting.